Good morning, Dr. Towson again, coming Ackerman and Towson Dentistry. I thought I'd just touch base on a couple of things as we're going through this continued shelter in place. We get calls, people I think initially just reluctant to call because they don't know, am I supposed to call, am I not supposed to call, are you open, are you not open? And so what I thought I'd like to just kind of explain about is just what is a dental emergency. So we've got the ADA guidelines on recommendations. Kind of the first thing that they basically say is the dentist should use their professional judgment in determining a patient's need for urgent or emergency care. And so I guess the point of that for me is, we want to give you the freedom to certainly give us a call. If you're concerned that something's not right, it doesn't feel right, it doesn't, it's not the way it used to be, it's really, you are welcome to call. I'll answer, Dr. Ackerman will answer, someone will get back to you. And a lot of times what we're doing is just assessing, what is going on? Is this something that needs to be cared? A lot of times it can be as simple as just having that conversation. Now there are instances where, boy, there is an emergency. And the guidelines basically at this point specify emergency care is basically if you're having pain, if you notice things are swollen, or there's a sign of infection, or if there's bleeding. Those things you certainly give us a call. Again, we can talk through that. And what typically then will happen, we'll decide, and is that something we need to evaluate? Is that something that we can manage just over the phone, if that's the case? The other thing is what they call urgent care. Urgent care is a little less precise, but those are certainly things that we have a conversation about. That can be things that are broken, whether it's a crown, it's your tooth, something that is sensitive, something that is uncomfortable. Maybe there's a temporary crown that got placed that we haven't had an opportunity to place the permanent crown. Those would be things. Anything that really is symptomatic. Now, the guidelines talk a lot about pain. Now, what certainly, again, my professional judgment or my concern is, we've been sheltered in place for a little over 2 months now. There were things that were scheduled for people to have addressed. And the timeline now, I'm assuming we're all going to be starting back hopefully at the beginning of June and we can get these things addressed. But there are things that maybe this continued timeline may cause things to get a little more involved. Now, it's not a comment to scare or worry anybody. But the way I would like you to evaluate that is if you notice something, maybe something just feels different. It doesn't have to be painful. It may be sensitive, it may be cold, pressure, maybe I bite down, it doesn't feel the way it used to. Those are all things that I think would be prudent at least to have a conversation, and we can talk about what the prudent next step would be. The way we're sort of addressing things is we are, accommodating emergency patients, people who are having symptoms in some fashion. The way we're doing is a lot of times we'll come in, we're going to evaluate it. If it's something that we can do where it's something that we're going to temporize, that can get you a little farther down the line, assuming that we're going to open shortly, or are there things that maybe need some definitive care? Maybe there is something that we need to do. Then we'll usually get you back at a different day and do what needs to happen to make sure that this delay, this new kind of situation that we're in isn't creating problems for people. Again, my comments are not geared to frighten or worry anybody. We're just trying to make sure that you're getting the care that you deserve in a different environment as we move forward. So the take-home message, if you're concerned, certainly give us a call. I'm generally receive most of the calls. I'll try and get back to you as promptly as I can. Otherwise, continue to do what you need to do to keep yourself safe. We're always here, and we're looking forward to getting back and caring for you the way we typically do. God bless.